Welcome to the deep dive. Today we're going to be looking at the support systems in place for those dealing with ARDS.
Yeah, that's a acute respiratory distress syndrome.
And we don't often hear about all the different ways hospitals help these patients beyond, just the medical treatment.
Right.
Huh.
It can be pretty serious lung injury.
Yeah, and it can be triggered by all sorts of things, right?
Yeah, absolutely. So,
Oh.
pneumonia, sepsis, trauma, even inhaling harmful substances.
And a lot of times these patients end up in intensive care, which I can only imagine is incredibly overwhelming for everyone involved.
Oh, absolutely. It's a very critical condition.
And that's why I think this deep dive is so important. Our sources this time, they really focus on the medical side of things.
Yeah.
But we're going to kind of branch out a little bit and talk about the emotional and social support that's crucial in these situations.
Yeah, I think that's so key because ARDS treatment, it really involves a whole team of specialists working together.
It's a village, isn't it?
It really is, and it's not just about, the physical care. Hospitals also recognize the mental and emotional toll this takes on patients and their families.
Exactly. There's a whole network of support in place, from respiratory therapists to nutritionists to social workers. It's like this hidden world most people don't even know exists until they need it.
It really is, and it's all about helping patients breathe easier and ultimately recover.
Okay, so let's start with respiratory therapy because, their role seems pretty intense.
It is. They're the ones managing the ventilators, making sure they're calibrated correctly for each patient's needs.
Wow.
They monitor blood gases, oxygen levels, administer medication, and even guide patients through pulmonary rehab.
It's interesting to me that they're there for both the critical phase and the long recovery. It's not just about keeping someone breathing, it's about helping them regain their lung function.
Exactly, and think about it. They're essentially reteaching someone how to breathe on their own again.
That's incredible. Now, something I hadn't really considered before is the role of nutrition in ARDS recovery.
Oh, it's vital. It's often overlooked, but ARDS patients are at risk for malnutrition. Really?
Yeah, their bodies are working overtime to fight the illness, and their metabolism is just thrown off by the stress.
So it's not just about calories. It's about making sure they're getting the specific nutrients they need to heal.
Exactly. Nutritionists carefully assess each patient's needs. They consider things like age, weight, the severity of the ARDS, any other underlying conditions. It's very personalized.
That makes sense, and I imagine in some cases they might even need to use feeding tubes or IVs if the patient can't eat on their own.
That's right. And beyond just providing the nutrition, they also educate patients and families about the importance of good nutrition for long-term recovery.
And that brings up another point that really resonated with me, the emotional and logistical challenges of ARDS. It's not just a medical issue, it impacts every aspect of life.
Absolutely. And that's where social workers come in. They play a crucial role in addressing those non-medical aspects of care.
Right, so they're like advocates for the patients and families, making sure their needs are heard and met. Exactly. They offer emotional support counseling, which can be a lifeline for families feeling overwhelmed and scared.
It's amazing how many layers of support there are within a hospital. I hadn't even thought about the educational resources they offer.
Oh, yeah. Hospitals understand that knowledge is empowering for patients and families facing ARDS. They often have patient educators who can provide information about the illness, causes, treatments, potential complications.
Wow, it's like giving them a roadmap to navigate this complex terrain.
Exactly. They address practical concerns, too, like how to manage daily life with ARDS, how to prevent further lung damage, and of course, support groups play a huge role.
Right, support groups provide that sense of community and connection that can be so vital during a difficult time.
Yeah, they offer a safe space for people to share their experiences, connect with others who understand and learn coping strategies. Knowing you're not alone can make a world of difference.
I bet, and it seems like that's a common theme running through all of this. It's about creating a safety net, a network of people and resources all focused on helping the patient and their family through this.
It really is. It's about providing not only medical care, but emotional support, practical assistance, and just a sense of hope.
Speaking of hope, one thing I found really impactful in the research was the emphasis on the role of communication in ARDS care.
Oh, absolutely. Clear communication is essential, open dialogue between the medical team and the patient, involving the family and making sure everyone understands what's happening and what the treatment plan entails.
And that communication extends to respiratory therapists working with patients who might be on ventilators and unable to speak for themselves.
Right. They become incredibly skilled at using nonverbal cues, visual aids, and even assistive communication devices.
So they really have to go the extra mile to connect with those patients.
They do, and it's a testament to their dedication and compassion. They understand that even when verbal communication is difficult, Human connection is still possible and incredibly important.
That's really powerful. Now, I want to circle back to the nutrition aspect for a minute. I'm fascinated by how they tailor their approach to each individual patient's needs. It's more than just handing someone a meal tray, right?
Oh, it's far more complex. Nutritionists have to consider so many factors: the patient's medical condition, age, weight, dietary preferences,
Hmm.
cultural background, food allergies. It's like piecing together a puzzle.
Yeah, that's a great analogy. It's like a custom designed nutrition plan, constantly adjusted as the patient's needs change.
Exactly. And it's not just about the food itself. They also provide a lot of education and support, teaching patients and families about healthy eating habits, how to manage any dietary restrictions.
It's about empowering them to take control of their own health.
You got it. Now, speaking of empowerment, I think it's important to touch on the role of social workers in supporting families of ARDS patients. It can't be easy for loved ones to watch someone they care about go through such a serious illness.
Absolutely. They're often dealing with their own fears and anxieties while trying to be strong for the patients. So, how do social workers help them cope?
They provide a whole spectrum of support: emotional support, counseling, practical assistance, and advocacy. They might help families find affordable lodging near the hospital, connect them with support groups or financial resources, or even just be a listening ear.
It's like having a dedicated guide and advocate within the hospital system, someone who understands their unique needs and challenges.
That's a great way to put it. And they also act as liaisons between the family and the medical team, making sure everyone is on the same page and that the family's voice is heard.
That communication piece is so crucial, especially in a situation that can feel so overwhelming and out of control.
It really is. And speaking of feeling overwhelmed, I think it's important to acknowledge the emotional and psychological toll ARDS can take, not just on the patient, but on their loved ones as well.
Right. ARDS is a whole body experience, and that includes the mind and spirit.
Okay.
So, how do patient education and support groups address that aspect of the illness?
Well, patient education helps by providing information and answered questions, which can reduce anxiety, and fear support groups provide a safe space for people to share their experiences, connect with others who understand and learn coping strategies.
It's about creating that sense of community and normalizing their feelings, letting them know they're not alone in this.
You're right. And it's also about validating their emotional experiences. ARDS can be very isolating, and it's important for people to know that their feelings are valid and that they're not weak for struggling.
That validation can be so powerful. Are there any specific resources you'd recommend for people looking for more information and support, specifically related to the emotional and psychological aspects of ARDS?
Absolutely.
Yeah.
The ARDS Alliance is a great resource. Their website has personal stories from patients and families, tips for coping with stress and anxiety, and links to support groups. And there are many online forums and communities where people can connect and share their experiences.
That's fantastic. I'm so glad that those resources exist. It's a reminder that even in the face of a serious illness, there's always hope and there's always help available.
Exactly. And speaking of help, there's another important aspect of hospital support services that we haven't talked about yet: discharge planning.
Discharge planning, that's something I hadn't even considered.
It's often overlooked, but it's a crucial part of the recovery process. After spending potentially weeks or even months in the hospital, patients need ongoing care and support when they return home. It's a big adjustment.
That makes sense. So, what exactly does discharge planning involve?
It's a collaborative process that involves the patient, their family, and the medical team. They work together to create a plan that ensures a smooth transition back home.
What kinds of things are included in that plan?
It varies depending on the patient's individual needs, but it usually includes medication instructions, follow-up appointments, home healthcare arrangements if needed, equipment needs, and resources for ongoing support in the community.
So, it's about setting them up for success, making sure they have everything they need to continue their recovery safely at home.
Exactly. It's about empowering them to take an active role in their ongoing care.
This has been an incredibly insightful conversation. I feel like I've gained a whole new understanding of the complexity and importance of hospital support services for ARDS patients.
It's been a pleasure sharing this information with you.
You know, as we've been talking, I've been struck by the incredible teamwork and coordination that goes into providing this support. It's truly a multidisciplinary effort.
You're right. It takes a village to support someone through
Yeah.
ARDS, and the hospital setting provides the perfect environment for that village to come together.
And it's not just about the medical professionals, it's also about the patient's family, friends, and community all playing a role in their recovery.
Absolutely. Everyone has something to contribute, and every bit of support is valuable.
I think that's a beautiful message to leave our listeners with.
I agree. No one should have to face this alone. There's a whole network of support available, and it's there for a reason. Don't be afraid to ask for help. Utilize the resources that are available and connect with others who understand what you're going through.
That's such important advice. And remember, knowledge is power. The more you understand about ARDS and the resources that are available, the better equipped you'll be to navigate this challenging journey.
Absolutely. And don't forget about the power of hope, even in the darkest of times. There's always reason to believe that things can get better.
Well said. We'll be back soon with part 2 of this deep dive into hospital support services for ARDS. Until then, stay informed, stay connected, and stay strong. Welcome back to our deep dive into the world of hospital support services for those with ARDS.
We've covered a lot, but there's still more to uncover.
I've been thinking about our conversation on nutrition, and I'm curious about the challenges they face working with ARDS patients. What are some obstacles they might encounter?
One of the biggest is the fluctuating nature of the illness, the patient's nutritionals. They change rapidly, depending on the severity of their ARDS and how they respond to treatment.
So it's not a one and done kind of thing?
No, not at all. Nutritionists have to be super adaptable, constantly assessing, checking labs, talking with the medical team to make sure the nutrition plan is meeting the patient's needs as they change.
Sounds like a tough job.
It is. And another challenge is that ARDS patients are often on multiple medications,
Oh, right.
some of which can interact with food or affect how they absorb nutrients.
So they have to be aware of all that and adjust the plan.
Exactly. They might need to time meals around medication schedules, avoid certain foods, or even supplement specific nutrients if absorption is an issue.
It's amazing how much specialized knowledge goes into this.
It really does.
I want to shift gears a bit and talk about the emotional toll of ARDS on families. We touched on this, but I think it deserves a closer look.
Yeah, for sure.
What are some specific challenges they might face?
Well, first, there's the fear and anxiety of having a loved one so critically ill. ARDS can be unpredictable, and families often feel like they're on an emotional roller coaster.
I bet that's exhausting.
It is. And on top of that, they're dealing with practical challenges, juggling work, family responsibilities, finances, insurance companies.
That's so much to deal with when you're already emotionally spent.
Exactly. And then there's the potential for guilt and self-blame families wondering if they could have prevented the illness or if they're doing enough.
Those feelings are so understandable, but they can be so hard to deal with.
Absolutely. That's why it's vital for families to have emotional support and counseling a safe space to process their feelings, learn coping strategies, and just be reassured they're not alone.
So important. What can friends and family do to help someone going through this? It's hard to know what to say or do.
It is, and there's no one right answer, but some things that can be helpful are offering practical assistance, like running errands, helping with childcare.
Right? Just taking things off their plate.
Exactly. Just being present,
Yeah.
listening without judgment, and expressing love and support without trying to fix the situation.
Just being there can mean so much.
It can, and remember, families need support both during the hospital stay and after the patient goes home.
That's a great point. Recovery doesn't end when you leave the hospital.
It can go on for weeks, months, even longer.
Speaking of transitions, I want to go back to respiratory therapists and their role in ARDS care. I'm intrigued by the pulmonary rehabilitation aspect. And what does that involve, and how does it help patients regain lung function?
Pulmonary rehab is a comprehensive program combining exercise, education, and support,
Oh, wow.
all to help patients breathe easier and improve their quality of life.
So what kind of exercises are we talking about?
It can range from simple breathing exercises to more strenuous activities, depending on the patient's strength and endurance. They might start with things like pursed lip breathing or diaphragmatic breathing.
I've heard of those, but never really understood how they work.
Well, pursed lip breathing helps slow down the breathing rate and keeps the airways open longer, which can improve oxygen exchange.
Oh.
Diaphragmatic breathing strengthens the diaphragm muscle, which is the main muscle we use for breathing.
So it's not just about getting more air, it's about using the right muscles and techniques to breathe better.
Exactly. As patients get stronger, they might progress to walking, cycling, even swimming.
I can see how that would help build stamina and lung capacity.
It does. And it's not just physical pulmonary rehab. Also helps patients manage their anxiety and improve their mood.
Oh, that makes sense. Exercise releases endorphins, right?
It does. And feeling stronger and more capable does wonders for your self-confidence.
Absolutely. And the education part of rehab is just as important.
Oh, absolutely.
What would they learn?
They learn about ARDS itself, the importance of taking their medications as prescribed, how to manage their symptoms, prevent further lung damage, and recognize any warning signs.
Wow, so they're really empowered to take charge of their own recovery.
Exactly. And the support groups that are often a part of rehab offer a valuable social and emotional outlet.
That sense of community again.
Yes, it's a reminder that they're not alone in this.
You mentioned that recovery from ARDS can be a long process. What are some of the long-term effects that patients might experience?
It really varies depending on the severity of their illness, their overall health, and other individual factors.
So some people might bounce back quicker than others.
Exactly. Some common long-term effects include fatigue, shortness of breath, muscle weakness, difficulty concentrating, and emotional distress.
That sounds like a lot to cope with.
It can be. And some patients might also have persistent lung damage, which can lead to chronic respiratory problems.
So even after recovering from the acute phase, they might still face issues.
That's right, and that's why ongoing support and medical care are so important, even after they're discharged.
Speaking of ongoing care, I'm curious about what that looks like. What kind of follow-up and treatments might they need?
It depends on the individual case, but typically they'll have regular follow-up appointments with their pulmonologist to monitor their lung function and make sure they're recovering as expected.
So they're not just on their own, they have a medical team with them?
Exactly, and in some cases they might need ongoing respiratory therapy, like supplemental oxygen or continued pulmonary rehab.
What about the emotional and psychological aspects? Do they need ongoing support there as well?
Absolutely. ARDS can be traumatic, and it's not uncommon for patients to experience anxiety, depression, or even PTSD.
I hadn't realized the psychological impact could be so significant.
It can be. That's why access to mental health services is so crucial, whether it's therapy support groups or medication management.
Another reminder that recovery is about more than just the physical body.
Exactly, and it's important to acknowledge that recovery from ARDS is not always a straight line. There will be good days and bad days, and that's okay.
So it's not a straight path, it's more of a winding road.
Exactly. Patients need to be patient with themselves and celebrate the small victories.
That's such great advice. It's easy to get discouraged when it's a long and challenging recovery.
It is, and that's where support from loved ones, medical professionals, and support groups is so valuable.
Speaking of support, I want to circle back to social workers and how they directly support patients.
They're incredible advocates, especially when it comes to navigating the healthcare system. They can help patients understand their insurance coverage, access financial assistance programs, and find transportation to appointments.
Those are all crucial things that can feel overwhelming when you're sick.
They can, and social workers connect patients with community resources too, like
Yeah.
support groups, home healthcare services, even vocational rehab programs if needed.
It sounds like they bridge the gap between the hospital and the outside world.
They do, and they provide emotional support and counseling too, helping patients cope with the challenges of ARDS.
It's amazing how much they do.
They play a vital role in making sure patients receive holistic care, addressing not only their physical needs, but also their emotional, social, and practical concerns.
You know, as we've been talking, I'm struck by how interconnected all these support services are. It's true collaboration, everyone working together.
You're right, it's a team effort with everyone playing a role in the patient's well-being.
And that teamwork goes beyond the hospital walls. It involves community resources, support groups, and of course, loved ones.
Absolutely, it takes a village to support someone through this.
It really does, and that's a powerful thing to remember.
It is. No one has to face this alone.
Now, before we move on to the final part, I want to touch on the role of research in ARDS care. I'm curious what's being done to advance our understanding and develop new treatments.
That's a great question. There's a lot of exciting research happening. Scientists are working to identify new biomarkers that can predict how severe the illness will be and personalize treatment plans.
So instead of a one-size-fits-all approach, we're moving towards more targeted therapies.
Exactly. And there's also research into new ventilation strategies, medications that reduce inflammation and lung damage, even stem cell therapies.
Wow, it sounds like there's real hope for the future of ARDS care.
There is. And the more we learn about this illness, the better we'll be able to prevent it, treat it, and support those affected by it.
This has been such an informative conversation. I feel like I have a much deeper understanding of all the work that goes into supporting these patients and their families.
It's been my pleasure.
Now, in the final part, we'll explore some of the challenges and controversies surrounding ARDS care, as well as look ahead to the future of research and treatment.
Looking forward to it.
We'll be right back. And we're back for our final look at hospital support for ARDS. You know, we've talked about the positives, but it's important to acknowledge there are challenges too, right?
Absolutely. ARDS care is constantly evolving. So there are always these debates about, best practices, resources, ethical considerations.
Yeah, one thing that really stood out to me was the discussion around the long-term impacts of being on a ventilator.
Right.
It can be life-saving, but it's not without risks.
Exactly. Mechanical ventilation is essential for a lot of ARDS patients, but it can also cause complications.
Like what kind of complications?
Well, things like ventilator-associated pneumonia, lung injuries, muscle weakness. And like we said earlier, it can be difficult to wean patients off the ventilator if they've been on it for a long time.
So it's a tough decision to make.
It really is. You have to weigh the benefits against the potential risks.
And that's why research into new ventilation strategies is so important.
Absolutely anything to minimize the time on a ventilator and make it less invasive,
Yeah.
less likely to cause harm.
Another challenge that came up was the issue of healthcare disparities.
Right.
It seems certain groups, especially those from marginalized communities, might not have the same access to quality ARDS care.
That's unfortunately true.
Mm.
There is evidence that things like race, socioeconomic status, where you live, can impact your access to specialists, timely diagnosis, and even the quality of treatment.
That's a big concern, what contributes to these disparities.
Well, it's complicated, but some factors include systemic biases within the healthcare system, lack of good insurance, limited transportation options, and even language barriers.
So it's much bigger than just having hospitals available.
Right. It's about addressing those social and economic factors that create barriers to care.
And making sure everyone has a fair chance to get the best possible care.
Exactly. Regardless of background or circumstances.
Now let's talk about technology and ARDS care. It seems like there are a lot of innovations that could really change how we approach this illness.
One exciting area is AI, artificial intelligence.
Oh, wow.
Tools that can analyze medical images, predict patient outcomes, even personalize those ventilator settings we talked about.
So AI could actually help doctors make better decisions and tailor treatment to each patient.
Exactly. And there are advancements in telemedicine too, expanding access to specialized care, especially for those in rural areas.
That's incredible. So they wouldn't have to travel far to see a specialist.
Right. They could have virtual appointments. And we're also seeing wearable sensors that can monitor vital signs, breathing patterns, activity levels, all in real time.
That's amazing. It's like having a constant checkup.
It is. You can detect early signs of problems or complications.
Technology is really changing things.
It is. But it's important to remember it's a tool, and it's only as good as the people using it.
We still need those skilled healthcare professionals to make the decisions and provide the care.
Absolutely. Technology can enhance care, but it can't replace human connection and expertise.
Now, I want to touch on the role of research in all of this. We talked about some of the exciting research happening, but what are the key areas scientists are focused on right now?
One big focus is the search for biomarkers that can predict who's most at risk for ARDS and who might benefit most from certain treatments.
So it's about that personalized approach again.
Exactly. And there's research into understanding how ARDS develops, what makes it more severe in some people.
It's about getting to the root of it all.
Right. Not just treating symptoms, but understanding the underlying causes and finding ways to prevent it.
And are there any new treatments on the horizon?
There are clinical trials going on right now,
Yep.
testing new medications, different ventilation strategies, even cell-based therapies.
Wow, it really sounds like there's a lot of hope for the future.
There is, and it's important to remember, research takes time. But each study brings us closer to really understanding and conquering ARDS.
This has been such an insightful deep dive. I've learned so much about the dedication of everyone involved, the complexities of ARDS, and the efforts to improve care and support those affected.
It's been my pleasure.
As we wrap up, I want to leave our listeners with this knowledge is power. The more you know about ARDS, the better you can advocate for yourself or a loved one.
Absolutely. Don't be afraid to ask questions. Seek out second opinions, connect with support groups. There's so much information and support out there. You're not alone.
And never lose hope while ARDS is serious. There's reason to be optimistic with research advancements and dedicated healthcare professionals. More and more people are surviving ARDS and living full lives.
That's a great point.
Thank you for joining us on this deep dive. We'll catch you next time for another insightful exploration.